Now, for those of you who have heard us before, you know we are experts on talking about joints, but today we're going to talk about a specific joint in the body, and that being a very specific joint in the body, that being the knee joint. Now, you think it would be so simple, it's just a hinge, but there's a lot of parts to this part that can go wrong, and we're going to give you a top 10 list of the things that can give you knee pain. And sometimes you'll hear voices and it'll actually tell you what those knee pain causes are. And number one would be osteoarthritis. Now this is the wear and tear of the joint. It'll give you pain and stiffness and swelling and a popping sound, a grinding. Osteoarthritis, number one, common.
Number two, there's a little cushion that sits between the bones of the knee called the meniscus. And it's right here. It actually prevents this bone from rubbing up against this bone. And that meniscus can tear in trauma or just deteriorate with age. And a torn meniscus is very uncomfortable.
Number three is ACL damage, or anterior cruciate ligament damage. And that's the four stabilizers of the knee. There's the anterior and posterior cruciates, the forward and backward stabilizers. And anterior cruciate ligament commonly tears in trauma sports, more so seen in females, so I think they're weaker.
Pizza can wreck your knees too, because too much of it causes too much weight. The knee is a weight-bearing joint, and a slight reduction in weight can actually reduce dramatically the amount of pain that you're having in your knees.
Number five, I think it is chondromalacia, or PFP, otherwise known as patellofemoral pain syndrome. The physiotherapist will often diagnose this. And they'll say the worn down cartilage will give you pain in the anterior part of your knee. And if you do physiotherapy to build up the muscles above and below the knee, it'll compensate for that weakening and get you back in the groove.
Baker's cyst is named after the doctor who discovered it, Dr. Cyst. And this is a swelling that comes up behind the back of your knee. I'll show you exactly where that is. So just behind here, if you're having pain behind your joint or a little swelling back there, it could be a Baker's cyst. And certainly if you had a lot of them, 13 of them, that would be a Baker's dozen.
Number seven, tibial tuberosity epiphysitis, or if you haven't heard of that word, you're more commonly known as Osgood-Schlatter's disease. Now, this is probably the most common cause of knee pain in adolescents. During their growth spurt, you see these kids that are very active in sports, whether they're running or jumping. I know I had a case of it when I was the team captain of our high school skipping rope team.
Okay. Wasn't the rugby team, I'll tell you that. Another one is osteochondritis dissecans. Now, I'm going to demonstrate with this little piece of chicken cartilage here in a second. Okay, see this little chicken cartilage here? All right, you remember that end of the bone here, the shiny part? As it dissolves, you can actually get a lot of discomfort. And that is when the shiny part turns into the bare part, and that rubs up against your joints and causes a lot of discomfort. It's good.
9 is gout. Now, usually you'll see it in the big toe, but it can happen in the knee, and again, this can be related to alcohol, rich foods, gout.
There you got it. Low down on joints.